And I call on Christine Graham to speak to and move the motion on behalf of the Health and Sport Committee.
Dave Thompson to be followed by Angela Constance.
Thank you, Presiding Officer. Representing Scotland's largest parliamentary region, containing hundreds of large and small communities in remote glens, peninsulas and islands, I am very much aware of the challenge faced by our health professionals in delivering the care and support that our constituents need. In the past, this health care was delivered by innumerable village doctors and community nurses scattered throughout the Highlands and Islands, who made themselves available to their patients whenever the need arose. Times have changed, and now individual doctors are no longer available to serve their patients 24 hours a day, so we must look at new ways of delivering the ever more complex benefits of medicine and nursing care to patients throughout our rural and island communities. In this context, modern information and communications technology come into their own. They allow medical staff to spread their expertise over a far greater area than used to be possible by jumping into a car to pay a personal visit to a patient's home, or requiring a sick Highlander to make their way to Inverness, Broadford or Fort William for an often urgent medical appointment. In recent years, improvements in communications technology have allowed some of our more experienced doctors in Inverness, let's say, to use telemedicine to consult with patients in Caithness, Skye or the Western Isles, using a video conferencing link to make an informed diagnosis of their condition and create an individual treatment plan for the patient. However, not all remote healthcare needs to involve consultants. At another level, it can involve an elderly or infirm patient wearing a sensor to alert staff in a sometimes distant care centre of any change in their condition. Sometimes this is as simple as a button on a box around their neck that can be pressed in an emergency. But advances in this telecare technology have allowed this simple alarm button to be supplemented with a range of sensors to monitor breathing, blood pressure or heart rate. But in between these two extremes is telehealth. Increasingly, this allows health professionals to access a growing range of vital details about the changing condition of patients with long-term conditions, for example, diabetes or a history of heart failure, without the need for patients to leave their homes and be brought into often distant hospitals many miles from their local support network of family and friends. Now, this e-health has been adopted enthusiastically by healthcare managers and enterprise chiefs in the Highlands and Islands, not just for its benefits in spreading care to remote and isolated communities, but also in building a cluster of related businesses to help progress and test developments in this field in exactly the type of environment where it is most needed. The drive to capitalise on this new sector of healthcare was one of the key drivers between the decision of Highlands and Islands Enterprise to invest £24 million in the creation of the new Centre for Health Sciences beside Raigmore Hospital in Inverness. It is here that e-health companies are being encouraged to congregate, to allow the cross-fertilisation of ideas and knowledge in a manner similar to that seen in Silicon Valley in California when great advances in computing were seen in recent decades. This cluster of cutting-edge researchers operating from the Centre of Health Sciences has helped to establish the region as an internationally recognised centre of excellence in this pioneering area. The dividends from this strategy are already bearing fruit, and so far this year, some of the world's leading communications and telehealth experts have gathered twice in Inverness for major conferences on e-health. While current developments in telehealth require only a relatively conventional mobile phone or traditional landline telephone connection to operate, there is growing concern that the patchy provision of broadband, already mentioned, in rural areas will shortly have a limiting effect on the next generation of e-health developments in exactly the areas where they are needed most. The report touches on this in paragraphs 78 and 79, and I quote, "A key piece of infrastructural development necessary to support such telehealth services is the availability of high-speed broadband internet access. As with many other aspects of the public services, broadband access is especially important in remote and rural areas. In our view, the forthcoming telehealth strategy must clearly set out how such services will be delivered and how this links with the Scottish Government's broadband development policy." Now, unfortunately, responsibility for Scotland's broadband infrastructure is actually a matter reserved for Westminster. Although the Scottish Government has done what it can to support the rollout of this vital new communications technology into communities where it is desperately needed. Westminster's approach, of course, often appears to be that this rollout should be driven purely by commercial considerations. But, regrettably, businesses with a role in delivering the telecommunications infrastructure needed for modern broadband access will always concentrate on areas of high population rather than scattered communities in large regions. So we must have government intervention to help with this. We must therefore do all we can to encourage Westminster to ensure that Scotland's rural and island communities catch up with provision taken for granted in the rest of the UK, and which will allow us to fully benefit from the important developments that are taking place in e-health. Jamie Stone and Liam MacArthur have already touched on this, but we don't need yet another Lib Dem campaign and petition. You are in government now, gentlemen, and Jeremy Hunt must deliver on broadband for the Highlands and Islands. No more petitions, no more political games, no more spin, but real progress is what we need from Jeremy Hunt and the Lib Dems in London. If I have time.
Very briefly, Mr Purvis, you're in your line.
I'm grateful. I'm sure the member is aware of the Pathfinder North project that connected the schools to broadband, fully delivered by the previous Scottish Executive. What prevents the Scottish Government from doing an equivalent within health?
You're in your last minute, Mr Thompson.
That's okay, thank you. Well, I think Mr Purvis will find that the Scottish Government has done many things within the limited powers that we have here. It doesn't change the fact that responsibility primarily rests with Westminster. If it rested with us in this chamber, I don't think we would have any problem getting all of you to agree that we need to do something really serious about this. Jeremy Hunt and the Lib Cons in London now have the power over this and have control of the purse strings through a Highland MP called Danny Alexander. So, Mr Purvis, if you want to influence improvements on broadband in the Highlands and Islands, get on to your own MPs.